Good afternoon, everybody. We just Suzanne, can you mute all, please? We're just admitting people and waiting for a few more people to join. Then we will start maybe a minute or two. Suzanne, is everybody in from the waiting room?
We're still waiting for a few more. That's busy connecting.
Okay, all right. I see 51 now. Okay, I'm going to start off by saying good afternoon, everybody. Good morning if there are friends from the US joining us. Good afternoon, everybody. My name is Marieke de Villiers. I'm a family physician from Stellenbosch University, South Africa. And I'm the STRIPE coordinator for AfriHealth. And once again, I would like to welcome you to the third Training of the Trainers workshop this afternoon. It's not a webinar, it's a workshop today. So it will be much more interactive. And thank you so much for joining us on a Friday afternoon. But I'm sure you're going to have fun. So I'm going to introduce you to the speakers. We've got actually the main facilitator. We don't really call them speakers in the workshop because it's interactive, is Professor Hoffi Conradi. Many of you will know him. He's also a family physician from Stellenbosch University, actually retired, but he's working more than ever before. And then Dr. Francois Coetzee, who is a younger family physician working at the Rural Clinical School, will assist him with that. So Hoffi, I will hand over to you then.
Thank you, Marieke. I also would like just to, I would also like to just introduce the facilitators. Francois, Debbie, can you introduce yourself and also say what your profession is, please?
Hello, everyone. Hi, I'm Deborah Wilson, or call me Debbie. I'm actually a pharmacist by training, but at the moment I'm currently a lecturer at Stellenbosch University. I lecture postgraduate pharmacology to nursing students. So nursing students from a variety of different backgrounds. I've been doing that for about the last 8 years. And at the end of last year, I joined the SunStripe team to help develop some of these programs.
Tandy?
Hi everyone, my name is Tandy Conradi. I'm a physiotherapist by profession. And I'm currently doing my master's in physiotherapy and doing part-time research.
Thank you, Tandy. Talita?
Hi everyone, I'm Talita Crowley. I'm a nurse working at the Department of Nursing and Midwifery at Stellenbosch University. I'm currently working at home, so you'll hear my kids, so apologies for that. But yes, I joined the team, SunStripe team last year, and happy to be here.
Okay. Thanks so much. And Marieke and Francois, you've met already. So I'm going to share my PowerPoint screen and then we could start. So as Marieke has said, this is a demonstration of how we run the SunStripe HIV modules online, usually in a 90 to 120 minute, 1.5 to 2 hour session. We've chosen the module 5 today, the care of the adolescent girl at risk for HIV. And this module has been adapted by the team that you've met today. Plus some other members and occupational therapists as well as helped us a lot with developing this module. I think you are all used to Zoom by now. Kindly mute yourself, but we do ask that when you are in the small groups, in the breakaway groups, that you obviously unmute yourself and also show your video, please, if your bandwidth will allow that. At any stage, if you want to say something, you can raise a hand and we'll unmute you so that you can make a comment or a suggestion or ask a question. And at any time, please use the chat box. I'll ask Mariki and Francois just to keep an eye on the chat box and let us know if there's anything in the chat box that we should respond to. The feature that we will use today quite extensively is the breakout rooms. So when we go into a breakout room, you will get a message to say that you're invited to breakout room 1 or 2 or 3. We have 6 breakout rooms with 6 facilitators. Then you just click on join and you will join that and it will take you to that breakout room. We will send messages to you in the breakout room. Suzanne will do that when the time is nearly finished or where there's a change of activity in the breakout room. And then you will return automatically to the main group. You don't have to do anything. It will bring you back automatically. So normally, as we've said in the other webinars, we prefer not to have more than 5 participants in a breakout room. Because so many people registered for this workshop, we will be more than 5 people per facilitator. So we're going to ask our facilitators to manage that. The bigger group, maybe they will ask some of you not to be observers and others to be participants if the group is very big. We also normally try and set up the breakout rooms beforehand so that there is an equal distribution of the different professionals in the breakout room. So this goal, the goal of this module is to prepare participants to recognize the unique aspects of caring for adolescent girls at risk for HIV and to provide team-based care for this patient population. We have 5 objectives, and for each objective, we're going to do activity or sometimes more than one activity in the breakout room. Because we have an hour and a half today, we might not be able to finish all the activities. We might not be able to do the last one. So the first one is about the factors that increase the adolescent risk of HIV acquisition. The second one is about taking a sexual history in young women or adolescents at risk. We then want to discuss the multidisciplinary strategies to prevent HIV. Pardon? Sorry. Okay. The third one is to compare multidisciplinary strategies to prevent HIV in adolescents. Then we're going to have a discussion on gender-based violence, and then finally, it's a more clinical topic on the management of vaginal discharge in such in an adolescent. You will see that I think you're familiar with these modules, that there's a combination between more clinical informational activities and more interactive. And this module is much more interactive. So in each module, we start with a patient scenario, and our patient today is Mary. She's 17-year-old, and she presents to the outpatient department with a vaginal discharge, which is noticed for a week. She actually lives with her grandmother, who is unable to pay for her school fees. As a result, Mary goes out with an older man who financially supports her. He provides her with some pocket money and other niceties. So now we're going to start then with our first activity. In this activity, we're going to give a little bit more time. So we're going to ask you in the breakout room just to say who you are, where you work, and what your profession is. And then in the discussion, we're going to ask you to list the factors that you think and your experience increase adolescent risk of HIV infection. So we are going to focus on the reasons why young women, adolescents may engage in high-risk sexual practices. We're going to ask you to share back in the main group. We'll probably ask 1 or 2 groups to share back, but we want all of you in your small group. Your facilitator will share this in your small group, and you will be able to put down, or somebody in your group can put down the different factors that you've discussed and then share it in the main group. Suzanne, we're going to make this a bit of a longer activity. So can you give us 10 minutes for this activity?
Offie, you are muted. Can't hear you. Offie?
Yes, my old problem.
That's okay. That's good.
Yeah, just I'm saying magically we all appear again on the screen from our breakaways. I hope you had a good discussion. I realized that because we're a big group, the introductions took a bit long. But let's just ask one of the groups to share. One can ask more than one group, but maybe Francois, can your group share your discussion?
Okay, there I'm unmuted. I can do that. So this is our slide. Yeah, so we managed to get in 2.5 minutes. I'm assuming you can see my screen.
We can.
Okay, brilliant. So my group was excellent in sort of giving rapid fire factors in what could be risk factors for adolescents to acquire HIV. And then poverty came under both individual and environmental aspects. And very much our factors related to the development stage of what adolescents are going through. Also interesting, we had affluence also as a risk factor, as poverty also. And then substance and drug abuse might be related to the cognitive development, in that adolescents are more at risk for making decisions that are risky, if you can put it that way, high risk decisions. And then it might also be related to low self-esteem and emotional and physical separation from their parents. And we were sort of interrupted with environmental risk factors, but peer group influence, poverty, and then what the family structure looks like, we had as environmental factors.
Thanks so much, Francois. I think for the sake of time, I'm going to continue, but one can ask other groups then also to give their input. I'm now going back to sharing my slide. Just a minute. I just want to share that. I see. Actually, in my group I shared the wrong the wrong PowerPoint presentation, so you can also see our group's discussion there. But what we will do then in the workshop is, this is the slide from the module, from the facilitators guide for the module. So these are the suggestions they had in the development of the module. So you can see, you can share with the main group how many of those factors were mentioned, and maybe there were other factors that is not listed here. So I'm going to go on then to our second activity, and this activity is about demonstrating how to take a non-judgmental sexual history from an adolescent girl. So this activity focuses on how to take a sexual history, which is often very difficult. It's often difficult for the patient. It's usually difficult for our patient, for our adolescent girl, but it's also often uncomfortable for us as healthcare worker. So what I want you to do now, just for a few seconds, is where you are, just write down for yourself whether you have any judgments or assumptions when you listen to an adolescent story. Just on a piece of paper, try and reflect on what are your judgments and assumptions when a 17-year-old girl comes to you in OPD with a vaginal discharge, and she is in a relation with an older gentleman. We'll just give you a few minutes of silence to do that. Okay, so we're going to divide up in our groups as follows, and this is quite a bit of a complicated activity, because there are 3 sides to this activity. So first of all, we're going to ask the facilitator just to ask one member of your group to be the patient and one member to be the healthcare worker who's actually taking the history. And this is the role, and we'll put this up in the small groups as well. This is the patient talking, a 17-year-old girl coming in from a primary care appointment, for a primary care appointment, sexually active with 2 male partners over the last 2 months, and have been using condoms but not consistently. Yeah, and so she presents with a vaginal discharge that she's concerned about. She's worried about the confidentiality of the conversation, because you don't want your parents to find out that you're sexually active, and you feel embarrassed to talk about your symptoms and don't feel comfortable speaking to your doctor about what you feel. The healthcare provider is in OPD seeing this patient. She just knows that the patient is coming. He or she knows that the patient is coming with a vaginal discharge, and you hope to be able to take an appropriate history to understand how to best care for this patient. The other members of the group, we're going to ask you just to listen to what's happening in this role play. And again, we're going to challenge you to turn your judgments, those judgments that you've had, that you've written down, turn those judgments into curiosity and turn your assumptions into questions. So then after the role play, we're going to ask you to discuss in your group, how was it to be the patient? How was it to be the healthcare provider? And once you've had some feedback, then we're going to ask you to fill in this table in your group. Why the reasons on the left-hand side, what are the reasons why taking a sexual history is challenging? And on the other side, what strategies can we make to make it easy? What strategies can we develop to make it easier to obtain a sexual history? So we're going to have give quite a bit of time to this. So Suzanne, we're going to give 12 minutes to this activity. So for the role play, we're going to give 4 minutes, and after 4 minutes, can you put a message up to say the 4 minutes is finished? Then we'll give 4 minutes for discussion, and then of reflection of what happened, and then 4 minutes just to fill in this last table. So it's 4 minutes, 4 minutes, 4 minutes, Suzanne. So after every 4 minutes, let us know that we must change. We're going again to ask you to share your table that you filled in the main group. We're going to ask one of the members, the facilitator, can you please ask one of your members to share it in the big group? Suzanne, here we go, another breakout. I'm always making the same mistake. Welcome back, everyone. I hope you had a good discussion. Again, I realize the time is limited, but we just want to give you a feel for how we run these workshops. So I'm going to ask Talita's group, can you share your discussion?
Hi everyone. I didn't ask anyone to give feedback, but I can maybe ask Puli if he'll be willing to give feedback. Okay. He was a healthcare provider in this.
Okay. Yeah.
Okay, thank you so much, Talita. So the reasons why taking a sexual history is challenging from our group, that one of them, the patient might be embarrassed to say whatever she is having. And then as a healthcare provider, we agreed that we need to reassure the client and provide privacy and also build a rapport even before asking the client sensitive questions and also explain more. And the other reason was that lack of experience from the clinician himself on history taking. So the clinician needs training on communication skills so that he or she can obtain history and probe more from the clients, as we said that they are adolescents. And then the other one we saw that there was fear of judgment from the client and being reprimanded by the parents. So we need to reassure the client that we are going to maintain confidentiality at all costs. The last one was the healthcare worker who was judgmental to the client. So we need to ensure that we are not judgmental to what the client is saying. Thank you, Talita.
Thanks so much for Talita's group. Yeah, we just there. It's okay. Thanks so much for that. Okay, I'm going to share my screen again. Just want to share the right one. Talita, can you? Oh, this is the right one. Yeah. So now we're coming to the next activity, and here we're going to look at multidisciplinary strategies to prevent HIV in adolescents. So we're going to divide in groups again, and from your perspective of your profession, what is it that we could do to support adolescent engagement and retention in care? So how can we create a health service where adolescents would feel free to come, where we can support them, engage with them, and that they would come back, that they would not be put off by our health service? So we're going to do this discussion in from the perspective of the healthcare worker, from the community activist, and from peer advocates. And then we're going again to ask you to share back from your main group to the main group. So this is the template what we're going to use. So doctor, nurse practitioner, community activist, NGO, and peer advocates. I'm going to ask group 1 and 2 to look at the doctor, nurse practitioner, healthcare worker. Group 3 and 4 to look at community activists, and group 5 and 6 at peer advocates. What do you think as the strategies that we can use to prevent HIV in adolescents? So this time we're going to make the activity shorter. Suzanne, can you give us 8 minutes for that? And then just give us 3 minutes, tell us when 3 minutes remains, and then make sure that there's somebody in your group that will share back from that group. 8 minutes, Suzanne, thank you. This time I remember to unmute myself. Welcome back again. I'm again aware of time. So I'm going to ask group 5 just to their discussion on peer counseling.
Thank you. I am going to represent group 5. This is David. We were discussing on peer counseling, and we had quite an experience from our team members. And we do note that one of the things that has been noted within use of peer advocates is that they've acted as part of youth groups. They've also come in strongly as being able to promote skills, as well as promoting health education, passing information to promote prevention. And then we also talked about having some of them as role models. For example, there's a program that was looking at recruiting pregnant mothers and women who are already adolescents, and therefore they're able to pass information and mold the other pregnant, other clients who are adolescents. We also talked about being part of the leadership, engaging them to make decisions within health facilities and communities. And therefore, that has led to some changes happening within the facility that increased accessibility as well as utilization of health services among the adolescents. We also talked about having them being able to enlist some church youth groups, being able to support the adolescents to protect themselves, as well as passing information. And we've seen a lot of uptake of counseling and testing among adolescents because it was being promoted by their peers. Thank you.
Thank you so much, David, for that. I would normally ask the other groups to respond as well, but because of time, I just want to give you a feel for the module. We're going to go on to the next activity. I just want again to share my slide. Let's get the right place. So we've done that. So again, there's a slide that comes with the module, and these are suggestions from the module for these activities for the different categories. So one can see how this compares with what we discussed and if there are new suggestions as well. So I'm going to go on to the third activity, still part of the third activity. So this time we're going to look at clinical strategies to reduce acquisition and transmission of HIV infection in adults. So in your group, discuss what clinically can we do to reduce HIV acquisition infection in adolescents. And this is the slide that we want you to fill in your group. So Suzanne, can you give us 5 minutes for this discussion? Welcome back, everyone, again. I'm going to ask Tandi's group just to share their slide, if possible, or their discussion.
While I share my screen, is there anyone from my group who would like to volunteer to give feedback?
Okay, I will do it. Can you share the slide,
Great.
please?
Thanks. Can you, oh, it looks like my screen share. Can you all see my screen?
Yes, we can, Tandy.
Okay, great, perfect. Go for it.
So in our group, the first item we mentioned was that to make sure that the adolescents take their medications, ensure that their viral load is low, ensure that they are using protective measures. Secondly, also to advocate for abstinence. If not, make sure safe sex, but also early detection and treatment of STIs, and increasing awareness on methods of HIV transmissions. And we must have a well-organized service for survivors of gender-based violence, as well as post-exposure prophylaxis. But also consider long-term depot prophylaxis for HIV, and also, as I said, post gender-based violence prophylaxis, but also peer groups in the schools, and making sure that HPV vaccination for females is given. Thanks very much. That was from group 6.
Thank you very much, Keaton.
Thanks so much for sharing that. I'm looking at the watch, so I think we'll have time for one more activity, and then we'll maybe just go through the other activities, just the last activity, just to show you what we would have done if there was enough time. So in this activity, oops, let's just get to the right place. Yeah, sorry, I just wanted to share this. This is the answer slide to the discussion we have now. So what they mentioned here is condoms, PrEP, and PEP, adherence to HID, screen for STIs, couples counseling, and so on. And this is what you've all mentioned, and even more. Okay, so we're going now to have a discussion on gender-based violence in our community. And I'm going to ask Suzanne to share a video, just a short video clip for us on gender-based violence prepared by the WHO. Suzanne, I'm going to stop sharing.
Thank you.
One in 3 women experience violence at the hands of their husband or partner. That's over 800 million women worldwide. These women can feel trapped, afraid. Their lives are often restricted. Those who consider leaving often fear ending up penniless or losing their children. Over time, their confidence slips away, making a life without violence seem a distant memory. The abuse can lead to injuries, as well as serious physical and mental health problems, in some cases, even death. Many women contract sexually transmitted infections or have unwanted pregnancies, and when pregnant, have a greater risk of miscarriage or of having a premature or low birth weight baby. They can experience depression, anxiety, other mental health problems, or become addicted to drugs and alcohol. It can be hard to know who to trust or where to turn. But there is a place they can go. A visit to a local clinic is often one of the few opportunities women have to go out alone. And it's important for doctors and nurses to make sure this isn't a missed opportunity. When doctors, nurses, and midwives listen with compassion, survivors are more likely to share their story. When they ask the right questions, they can uncover what is really happening and challenge cultural attitudes that say it's okay for a husband to hit his wife. They can reassure women that it's not their fault and can work with women to help them stay safe. And where necessary, connect them with other services that can provide, for example, shelter, psychological support, legal services, and financial opportunities. More women can find their way to a life without violence when changes are implemented across healthcare and other systems. Changes such as private rooms for consultations, training that enables doctors and nurses to respond better to women's needs, and raising awareness of the harmful consequences of violence for women and children and how to prevent it. Making these changes helps foster a culture where violence is unacceptable and where women have the courage to speak out. Imagine if that could happen to each and every one of those 800 million women.
Thank you so much for that. Mariki, I wonder if I can ask you, shall we rather stop here and then just maybe I could just go through the remaining slides and then ask people to feedback rather than going to another discussion?
Yes, Wolfie, I would actually like us to reflect a bit on the process of the workshop. I mean, I'm sure people have already done this workshop themselves pre-COVID. So it's not really the content that's important, but maybe just let people write in the chat room or speak up about, do they have any questions about the process of the workshop? How does that sound?
Yes, I'm just, yes, absolutely. What I'm going to do is just quickly show you the last activity. And this is more a clinical activity where we look at the management of the clinical management of this young patient with a vaginal discharge. So we've asked some questions here, and we actually ask people to share it in the chat space rather than having a group discussion. There's another question: what are the diagnostic tests available? And that's also sharing in the chat space. And then there's an actual discussion about the treatment of it. And we've provided guidelines here that we've sent out, unfortunately, a bit late to you, but one can share that then with the participants, and then they discuss how they would treat it. And so and then lastly, in the conclusion, we would ask people to share in the chat space what they've learned and what they would do differently as a result of this. So what I like you to do now is to share in the chat space, like Mariki said, how did you find this process? How did you find the workshop? And if you want to unmute yourself and share, please do that. So open to comments in the chat space or verbally.
And while you are doing that, can you put your videos on, everybody, because we want to take a screenshot that we want to send back to you. It's always nice because we've got pictures of conferences, but we don't get it. Yeah, that's nice. Keep going. Hello, Professor Mateta. So
how are you? How are you?
Very good, thank you, Alfred. Yourself? Oh. So, Alfred, do you want to say something about the workshop?
Let me just say that it has been very interesting. It's not about, as you said, actually the most important thing is the process, to understand the process. But maybe in the same vein, let me say that, can you share what kind of ICT support personnel you may require for you to run a successful session like this one? Do you think the teacher can do it himself or herself, or need some support from ICT?
Yes, Hoffie, before you answer that, Suzanne, are you taking a screenshot? There's 1.5, there's this page, and then there's another half page of people. The others haven't done it. So are you doing that, Suzanne or Francois?
I'm in the
So Hoffie, can you answer Alfred's question?
Yes, Alfred, thanks for that. I think it really helps to have somebody like Suzanne, who's our administrator, who's been running this workshop in the background. So it's really what Suzanne does is she sends out all the invitations for people to register. When they're registered, she sends any pre-reading to them, and then as I said, if possible, divide the groups up beforehand, and then during the workshop, it is really useful to have her in the background, making sure that the groups work. As you've seen what she's done, she activated the groups. He told us when we're about to finish. So it's really, I think, important to have that Suzanne-like person to help you.
So
Suzanne,
she's not she's not an IT person. That's what we asked you to choose a person who is your e-learning coordinator or administrator, but she's young. That's why they can do these things. And I think they're also going to get a workshop how to do the LMS. So there was something in the chat about the pre-reading should count 24 hours before at least. Yes, I agree with that.
Yes, we apologize for that. Well, even more than 20. What Suzanne would normally do as soon as the person is registered, we'll send the pre-reading then.
Right, and there's something else in the chat.
That would be great.
Right. The workshop is engaging and making learners active. Time might be a challenge as well as prompting participants. Yeah, I just want to add, so we said in the workshop on Tuesday, the facilitator participant rate should be 1 to 5. So you could see the difficulties in having groups that's bigger. I see, Francois, have you got your hand up?
Yeah, just back to the technical person or the IT person. It's so important to have a practice run or two so that everybody gets a feel for how the process works. So I strongly encourage that for anybody that's wanting to do this, have a practice run or two, get some people that's willing to be part of it so that you can just get a feel for the breakout rooms and how it works.
Yeah, I'm glad somebody says it's interactive, although it's online. We'd really like you to use this interactiveness. And you can also see the facilitators with a spread of professions. We've also asked, when we did it with the students, some of the senior students, once they've done the workshop, they're willing to facilitate, because you don't have to be a content expert. Like in my group, myself and a few others don't work with HIV, but then the others help with that. So
yeah. Just about the time management, there was a comment about time management, and I absolutely agree that that is critical. So I had a template next to me that I sort of glanced at every now and then to see how we're doing for time. And in spite of that, we didn't have enough time. But this workshop we would normally run over in over 2 hours.
we would also get more feedback from the other groups also, so that you can draw all the groups in. Otherwise, you lose a bit of that.
Yeah.
Yeah.
Hello, David. Something from your side?
Thank you, Marike. Yeah, thank you very much. It has been a great learning curve as usual. Particularly the the programming to move to the breakouts, discuss, come to the main group, and all sorts of things, so that it's not waiting till the end of each of the breakout groups to now come and discuss. So as we all proceed, we learn from each other and everything. So it's really great. Thank you.
Yes, and thanks,
Mariki, there was also a question about facilitators. So it's important then to have your own facilitators that you can ask to facilitate the groups. And as Francois said, if you then have a practice run beforehand with the facilitators.
Okay. Thank you. Actually, that was part of but that has been answered. Alfred asked that question, and then we really get into. I'm sitting with e-learning coordinator, and so it's going along and we're already looking at how we're going to get this into our program when we take off. Thank you.
Okay, Offie, over to you.
Yeah, thank you so much for everyone attending, and I hope you will now be in a position to do it yourself or with support. Yeah, thank you so much for giving us your Friday afternoon, and thanks Mariki, and thanks so much for our facilitators. Maybe I can just ask you, just if you can, just to stay behind the facilitators, and then we'll just have a short feedback session for us facilitators. Thank you so much, everyone, and
everybody.
have a good weekend.
Thank you.
Have a good evening.
Thank you.
Thank
Thank
you.
you.
Thank you very much.
Bye-bye.
Bye-bye.
Bye.
Thanks.
Thank you. Bye-bye.
Thanks, Deborah.